what exactly are peptides?
That's such a good question.
Peptides are essentially chains of amino acids, typically between the length of 2 to 50 amino acids in length. As they expand, they can wrap around each other, and they can become these things that we call proteins, right?
Dr. Andrew Hamilton is a pioneer in peptide therapy, helping patients optimize physical performance and overall well-being.
The medications, it was kind of figured out that they cause weight loss through side effects of the medication. So while they're trying to manage your insulin sensitivity, it decreases the movement of food through your gut.
There's an opportunity with these types of peptides that people that are getting older and older can actually get in like the best shape of their lives potentially. Why is it so important to work with a practitioner to get these peptides?
I think the biggest thing that you really need to take away is...
Hello, and welcome to the Invigor Medical Podcast. We are so excited to be back in studio. You maybe didn't realize that we haven't been in studio for a few months because we've still been releasing episodes. But for Derek and I, it's been a few months.
Yeah.
So good to see you.
It's great to see you again, yeah.
And if you're watching on YouTube, you can see why we've been out of studio, because we have built a beautiful new studio.
Brand new podcast studio.
Oh my gosh, it's so nice. We're in these really comfy chairs.
Nice table.
Super nice table.
Yeah.
There's a pillow behind me instead of the little stool that we used to sit at the table.
Yeah, there was definitely good memories with that. The
For
up
sure.
and down.
The up and down, trying to get the height just right, and then our producer having to come in to adjust the camera again.
That's right.
Yeah, but we're super excited, and it's kind of a special episode, not just because we're back in studio for the first time in months, but also because we have an in-person guest, which is super fun.
Yeah, we're absolutely honored to have Dr. Andrew Hamilton in the studio. He's our medical director, and I'll let him kind of explain his credentials and where he's at. Yeah.
Yeah, thanks so much for having me. Appreciate
We're excited
it.
to have you.
Super.
All the way
It's fun
from-
to be in the studio.
All the way from Detroit.
Absolutely.
Welcome to Washington.
Yep. So I'm a family medicine community physician. My primary occupation is I work in educational medicine. So I work as a core faculty on a residency program. I like to say that I teach future doctors to become good doctors. So I teach residents and I teach medical students. Doing that, I give a lot of lectures, we do a lot of reading, we do a lot of discussions where we try to stay right on the forefront of what's happening in medicine. And I kind of carved a path and an interest in men's health. And through that, I started giving a lot of lectures related to men's health and a lot of the topics that we'll be discussing today. And kind of found you guys and kind of have been carving my way into talking about some of the forefront medications related to longevity, vitality, wellness, things like that.
Yeah,
Things
absolutely.
we're all about here at Invigor Medical.
100%.
Vitality, longevity, those are words we use all the time.
All the time.
We should just make T-shirts.
We should. Honestly, we should. And
Honestly,
I
we
think
should.
actually, if depending on when this is released, we may or may not. We may or may not.
Smash the like button if you want a T-shirt. My son is such a fan of YouTube and wants to be a YouTuber, so he'd be so proud of me for saying that.
So proud of you. I actually wanted to say when we were looking for our medical director and medical spokesperson for this specific role, we knew that somebody was going to be here in studio, and so I was really grilling all of our candidates and really raking them through the coals. And I've got to say, I was incredibly impressed with Dr. Hamilton's knowledge of all of our treatments. I was really just going after him. And really, that's what we're going to be covering in today's episode, is we're going to be talking about kind of all of the treatments or a large number of the treatments that we carry here at Invigor Medical, and really what they can do for our audience. But with that being said, let's go ahead and just dive right in. In our space, in the healthcare space specifically, peptides have generated a lot of interest in this field and on the internet across the nation. Can you tell us a little bit more about what exactly are peptides?
That's such a good question.
Yeah. So peptides is a very generic term for something that has such a broad understanding and have so many different mechanisms of action, but peptides are essentially chains of amino acids, typically between the length of 2 to 50 amino acids in length. As they expand, they can wrap around each other, and they can become these things that we call proteins, right? And so peptides, although it's kind of a newer term in our vocabulary, they've been around forever. They're in our bodies. They're working with our metabolism. We use them on a daily basis, but we are just now starting to understand what they can do for us, or what deficiencies might, how that might infringe upon our life.
Yeah. Well, and peptide therapies, like we're getting a much deeper understanding of them now, but they've actually been around for a long time. Just like you're saying, obviously they exist in our bodies. They serve to as like a signaling mechanism for a lot of different things within our bodies. One of which, probably the one that's the most famous, is probably insulin, right?
Absolutely.
And the treatment of insulin administering insulin to diabetic patients has been done for almost 100 years now, right?
Yeah, and it's as we are learning more about insulin sensitivity and resistance in our bodies, there are different medications that are coming to the forefront of maybe better options than just giving us insulin. But without that foundational knowledge about how it works in our bodies and being able to see how, as a human, how do we respond to insulin, that's kind of how we've been able to get to where we are now with looking at other types of peptides as well.
Yeah.
I know I had a container of collagen in my pantry a few years ago that was collagen peptides.
Yeah.
So when somebody first said peptides, I was like collagen? I don't know. You don't really have a lot of understanding.
Yeah.
And I think it's a great conversation because I think that most people who have become familiar-ish with, peptide, yeah, I've heard that, are probably just going to immediately connect it to the one they've heard the most about, which is the weight loss peptide, Ozempic or what other name you might have heard it used as, right? And then really not understanding that something like insulin is also a peptide, or any one of the other numbers on the list that we're going to talk about today. So if you're listening and you've had any curiosity surrounding peptides and want more information, I would highly encourage you to continue listening, because we're going to really break it down with the help of Dr. Hamilton, thank goodness. So why don't we start right off the bat, right?
Yeah.
What's at the top of the list for us?
I think, right now, there's so many people that are interested in weight loss, and specifically, the name brand Semaglutide treatments, Wegovy and Ozempic. Those are FDA approved for the treatment of obesity and diabetes. Maybe we can dive a little bit into the use of peptides for weight loss, and maybe even talking a little bit about the FDA approval process for those medications.
Sure. So the GLP-1 agonist, which is the class of medication that all of these fit into, it's been around for a while, but we have studied it more as related to diabetes treatment.
Yeah.
And the way that we actually kind of developed this understanding of it being able to cause weight loss is by seeing in our diabetic patients kind of the side effects that they get from the medications, and say, hey, one of the things that we're seeing is weight loss. And that's one of the more dramatic side effects that can be seen, because it can visually be seen, right? It doesn't need to be monitored more than, okay, now my pants are fitting a little bit looser, my t-shirts are not as tight. And there are certainly other beneficial side effects that we are kind of learning about and studying right now for other advantageous uses. But the hot ticket item right now is, okay, we know that we're getting FDA approval for weight loss with these medications, and how can we maximize them to improve our health?
Yeah.
You kind of touched on kind of the FDA approval of them, and yes, there are brand name medications that have that FDA approval. They've went through the proper clinical trials with animal testing and with human testing, and they have multiple trials saying, okay, for this very specific reason, this medication can be used, and if you're not using it for this specific medication at this dose, it's now considered off-label use. And so now you're looking at medications. Well, when the dose of Semaglutide or Terzepatide changes, is that now FDA approved, or is that is that an off-label use? And just because you're using it off-label, does that mean that it is not beneficial still? Or, what are the harms and risks? And when we look at FDA approval, we're just seeing that, okay, we just don't have the scientific evidence. We don't have the data to support, a firm understanding as to, falling which way or the other in terms of making a statistically significant statement.
Yeah. I think bringing up off-label prescribing of treatments, I think, is really important, because, a lot of these peptides are fairly new and don't necessarily have a ton of studies, but can be prescribed off-label. Can you talk a little bit more about that process?
So we use tons of different medications for off-label use all the time. You very possibly could be taking a medication from your provider as an off-label use that he or she might not even be telling you, like, hey, we use this for, this disease or for these symptoms all the time.
So kind of just discretionary from the doctor's perspective?
Yeah,
a little bit?
Really, yeah. And is, from the physician standpoint, if you're discussing the risk versus benefits and you're saying like, hey, we use this medication sometime for these symptoms, this might be a good medication for you. Your doctor might not even be saying this is an off-label use. But, when we can weigh the side effects and the risk, the benefits, the alternatives of what we have in place, lots of different medications are used off-label.
Mm-hmm.
Yeah, 100%. To kind of dive right into this, at Invigor Medical, we sell compounded Semaglutide and compounded Terzepatide. Now, these are not the same, absolutely not the same as Wegovy or Ozempic, and so they are being prescribed off-label. Part of this is because of the shortage of the Wegovy and Ozempic shortage, which I don't know how much you know about that currently, and if you can speak to that at all.
Yeah, I know the shortage is really hard for patients to get their medications and really expensive for them to get their medications. The unfortunate thing is we will have patients on these medications and they'll be either making great progress with either their weight loss journey or with their sugar management.
Mm-hmm.
And all of a sudden they'll be cut off, and the answer that the patients typically get is just from their pharmacy, sorry, we don't have we can't get the medication. And, in our office, we do everything that we can. We work with pharmacists. We try to get them enrolled in different programs that the brand names are offering to try to get them their medication at either a cheap or expedited or affordable price. But, the honest answer is if it's not there, you can't take it.
Mm-hmm.
Yeah, but that really opens up. So when a drug is on the FDA shortage list, if a manufacturer can't keep up with the demand, then they're essentially required by the FDA to post it on their shortage list, which then allows compounding pharmacies to come in and compound these medications. And in this case, it's a peptide. So we have compounded Semaglutide and compounded Terzepatide. And so because they're compounded, they're not technically FDA approved, right?
Correct.
But that doesn't necessarily mean that their safety or efficacy isn't. There's risks and there's benefits to anything. And so if a practitioner wants to prescribe this medication off-label, they're totally qualified to do so.
Yeah, and so usually when it comes from the provider, it would be more of a recommendation in terms of, hey, I can't get you your brand name. I can't necessarily send you straight to this pharmacy, but it might be something that you want to look into if you don't want to be, off of your medication. A lot of these companies do have the providers that are able to talk with the patients and then kind of make that transition for them. But I think the biggest thing that really comes from it when you're grabbing a medication from like the compounding pharmacy is what it really is it's more work. It's more work for the provider and it's more work for the patient just to understand where they're getting it from, understand the risks up from where they're getting it from, and making sure that they have a good understanding that they're getting it from a reputable compounding pharmacy. Because, the compounding pharmacies, there's a lot of different kind of like tiers of like how the FDA or if the FDA even oversees the pharmacy at all. Mm-hmm. And for safety reasons, it's really important for a patient to ask the questions about the legitimacy of the compounding pharmacy that they're getting it from, and making sure that as a physician, you're an advocate for the patient and you're making sure that they're not doing anything that's going to create more harm for them than good.
100%.
Can I just ask a little bit of clarifying, because you guys are both saying this because I'm like layman here talking about compounding peptides, the compounding pharmacide. What does that mean? What are we talking about when you're saying that comparatively to just like the brand label, the Ozempic or Wegovy or whatever, and you're saying, and then they compound that? What does that mean? What am I missing here?
Yeah, good question.
Yeah, so compounding can mean a couple of different things, but essentially it means that a pharmacy is making the medication or providing a medication that for one is not coming from the brand name medication, and two might be either a change in dose, higher dose, lower dose, a change in the preservatives that might be in the medication, an an administration of the medication, providing an oral medication instead of something that's intramuscular, like an injection.
Or even the pen. I think that's one of the biggest issues is the shortage is partly being caused because there's not enough of those injector pens.
Yeah.
Okay, cool. I'm just like picturing in my mind like the name brand food that I love to buy, and then it's out of that, and then I go to the store and I find something that looks pretty similar, has almost all the same ingredients on the label, and is just not the exact brand that I always get, and I'm like, oh, this will do. Is that like too much of a breakdown and separation from what we're talking about here?
No, not entirely, because you are searching for a particular product to have a particular end result, but the two bags of the products that you're looking at might have nuances. They might have difference. Or they could be it could be a compounded medication because it has, instead of just one medication, maybe it's a combination of two medications. So instead of going and buying peas, you're buying peas and carrots.
Okay, interesting.
And actually, in that case, so in Invigor Medical, we offer compounded semaglutide, compounded Terzepatide, and oftentimes those are compounded with like vitamin B12. Or vitamin B6.
Okay.
And so they essentially get an additional dose of vitamin B12 or vitamin B6 with their semaglutide. And that can have an additional benefit as well to the patient.
Yeah. And then the research chemicals or things that are like, now we're now level down is like, I decided not to buy any brand at the grocery store, and on my drive home saw a guy in a truck selling what I wanted. I was like, let's just take this bet, right? I mean, are we drawing some good analogies here?
Some dude in a garage being like, hey, I've got some great stuff for you.
I grew these peas in my bathtub. Those aren't carrots in there too. But let's talk about that. That's something that we talk about as well, right? Because if we're talking about advocating for yourself as a patient, for providers, trying to recommend alternatives for their patients when they can't get that name brand that they need, but it's like, what's the best way to make sure that you're not putting yourself in harm's way by giving yourself something that's technically a research chemical? What does that even mean? Yeah,
and it's a really hard question. It's certainly a barrier that you have to overcome as a patient, but maybe asking questions such as, how many patients do you serve? What type of, negative feedback have you received from customers in the past? And that's one thing that you do have to remember. As a physician, I see them as a patient, and they see themselves as a patient, but to a lot of businesses, they're not patients, they're customers. And so you have to kind of be just kind of attuned to, is this more of like a profit-driven model, or is this really a wellness-driven model? And looking into maybe past lawsuits or barriers that the pharmacy has had to overcome. Right. And if you see a compounding pharmacy that's been around for a long time and they haven't really had any issues, and they have a lot of customers or a lot of patients, that might spark more confidence than the guy selling vegetables out of the back of his truck.
Yeah, exactly. Well, and to touch on that as well is, you can go to some of these sites and they will literally say, do not inject this into your body. This is a research chemical. And people still do this. And they're like, my subject has lost however many pounds. And it's just like absolutely crazy to me. But the other thing is, so like compounding pharmacies, to kind of like dive into that a little bit more, the difference a lot of times between compounding pharmacies and research chemical facilities is the source of their ingredients and the quality of that source. And so there's various levels. So you can have, I think the top grade is pharmaceutical grade, and then there's food grade, or is it human grade? I don't know.
I'm
way
above my pay grade at this
point. There's grades. So there's like pharmaceutical grade, there's food grade, and then there's like veterinary grade or like animal grade. And a lot of times these research chemicals are selling animal grade peptides.
Okay.
And so it's like that can have there's a lot of stuff laced in them. They source them from, kind of sketchy places and bad news bears. So
I love bad news bears.
But with that being said, like maybe let's focus in on specifically like semaglutide, Terzepatide, Liraglutide, and how they work specifically for weight loss.
Yeah. So the medications, like I said, it was kind of figured out that they cause weight loss through side effects of the medication. So while they're trying to manage your insulin sensitivity, it decreases the movement of food through your gut. So it can kind of make you feel fuller, longer, not as hungry. You might not want to pick up the dessert. It might sit in your stomach longer, and the breakdown is just not as, efficient as it might be. And through that side effect of, what you might describe as nausea, your appetites decrease. You don't feel the need to eat until you're completely stuffed.
Yeah. I feel like in our society as a whole, we are in such an obesogenic environment where it's just
word.
It is a big word. Thank you.
Thank
you. Where it's so easy to overeat, and where foods are so hyper palatable that it's like, unless you're doing something actively, unless you're to the point where you practically, have to do some sort of elimination diet or track your calories, or, for people that don't have the mental capacity, who are already taxed, their willpower is already to the max, and they're like, I can't do one more thing. This is such a godsend, right? And, some might say it's a miracle drug, which I'm sure you have plenty of thoughts on, and maybe we can talk more about, why this isn't necessarily a miracle drug and how there's specific things we need to address with it as well. But really, it's such an amazing tool that I think is going to revolutionize the medical field and revolutionize treating obesity.
Right. Well, I think we talked about on another episode even maybe I'm imagining a different conversation, but I was thinking about, for people who grew up in households where there was just always an overabundance of food, there was always really unhealthy processed foods, right? Who maybe have never had the opportunity to be in touch with their satiety cues.
Yeah.
Right. And so it's like, hell, I feel that way just about every Christmas, Right. For real though, there's like a period of a few weeks where I'm like, I don't remember the last time I was actually hungry. I've just been eating so much food nonstop.
Well, because it's also delicious, right?
Delicious.
Amazing.
And so then I started thinking and wondering, like, gosh, what if that was years? What if I'd lived my life that way for years? And to be able to have the opportunity to take something that supports me getting back in touch with what it means to be full and to not overeat, right?
Yeah.
Because that's essentially what you're saying these peptides accomplish within the body, right?
Yeah, and to kind of piggyback what both of you are saying is the other thing that we have to look at is kind of the speed that we live our life right now.
Yeah.
We are in a very fast-paced society, and if you want to go and stuff your face with food when you're extremely hungry, well, your brain's not even going to process that. It's full before you can get all that food in.
Yeah.
And so at that point, even it helps you slow down a little bit so that your brain can say, hey, you are full. You don't actually need the rest of the food that you normally eat. And I can actually tell you that now.
Yeah, that makes sense to me.
Absolutely.
And so Semaglutide and Terzepatide and Liraglutide, they're all essentially the same peptide, or are there differences between these three?
So they're all very similar mechanisms of action.
Okay.
Between the Liraglutide and the Semaglutide. They're both GLP-1 agonists, which, for the sake of kind of a layperson conversation, not super important. That's just the class of medication that we're throwing them into. But Terzepatide is a GLP-1 agonist, and it's a GIP medication. So it has an additional mechanism of action that helps provide some of these side effects or symptom management that we're seeing.
Okay.
So that's why, we're starting to see in some of the studies that there might actually be additional benefit to taking Terzepatide, possibly over the other two, or just saying in general that, hey, these GLP-1 medications are great.
Yeah.
The Terzepatide and the Semaglutide are both once weekly dosing.
Okay.
So whichever day of the week that you choose, every Sunday or every Monday, you inject it and you're done. The Liraglutide is a daily dosing medication. So that would be a daily injection that you'd have to take.
Yeah.
And from like the earlier medications, the Exenatide, Liraglutide, they started off as once daily, and now we have these once weeklies.
Yeah, that's absolutely phenomenal. There's also far on the horizon another medication I think called a peptide called Versatility. I don't know if you know anything about that, but supposedly it's going to be GLP-1, GIP, and glucagon, which to me is like going to be crazy. So that's something just to keep an eye out for. I have no idea when it's coming. I don't think anybody really knows when it's coming. Glucagon?
Well, it's one of those. It's just one of those another active molecules that's active in our metabolism, and it works against insulin. and, in terms of breaking down sugar, storing sugar, building up sugar, and the insulin resistance that we're seeing in type 2 diabetes, which is certainly correlated with the obesity epidemic in our country.
Mm-hmm. So there's it's a very fascinating and really like exciting endeavors of science is continuing to push this forward, which is really cool.
Yeah. And peptides have a lot of other uses too beyond weight loss, right?
Absolutely.
I think that's kind of what we end up hearing the most about, and I think a lot of people have familiarity with like those name brand GLP-1s that we've been talking about, right? And there's even a lot of judgment surrounding, right? People are like, oh, I see all these people on my Facebook have lost all this weight, and I know they're cheating or whatever, which, first of all, it's just awful. Go to bed, Sharon. But for real. But I think that there's a limited understanding of what peptides are, right? And that there's so much more beyond just the weight loss aspect of that, right? I've heard that there's even peptides that are good for your sex health as well.
Absolutely.
Okay, let's talk more about that.
Yeah, and so there's different aspects. I mean, when we start talking about sex health, we are talking about a huge variety of different problems or different conditions or different things that can contribute to your relationship with your partner. Mm-hmm. And, now that our culture is able to focus more on quality of life rather than, always being in the workplace, always worrying about quantity of life, there are different medications that we can use to help this part of our life to optimize it.
Sure.
And so I don't know if you want to give the introduction, but some of the medications that we're looking at, are PT141. You've got Oxytocin. Yeah. For men, you've got the sildenafils, the tadalafils.
Yeah. A lot of great options.
Yes.
Actually, I was going to say with PT141, that's another one of those ones where...
Sorry, I just keep thinking of a robot on Star Wars when you say PT141.
Anytime we talk about peptides, it's like CJC 1297.
PT141.
Yeah.
Sorry, I was trying not to giggle, but I couldn't keep it in.
But so PT141 is actually super interesting because it was initially being studied as a potential like synthetic tanning agent.
Yes.
I don't know if you knew that.
Tanning agent?
Yeah, so like it was like where essentially you inject it's the full name of PT141 is something called bremelanotide.
Okay.
And so the key word being in there melanin.
Okay.
And it affects this part of your brain. I think it's called the I'm totally spacing it. The preoptic area of the brain. But they were doing these studies to see if it would make people more tan, and it did.
What?
But they found that it had a side effect.
That's just like we were talking about.
Right.
There you go.
There was a side effect that they actually then started using it for as the treatment, which it made people like crazy horny.
Tan and horny. I'm ready for vacation.
That's right. And so
crazy.
so it's one of these things where like the peptide was initially said, oh, this looks like it's made to make melanin slightly darker, but it caused an entirely different scheme of things. Which actually, when you look, I could nerd out about this all day, which I won't because we've got things we need to cover. But like if you look at like animals as they go into the winter, especially like rabbits, where their color of their fur changes from brown to white. That's partly due to the actual amount of light in the sky, and when that happens, this is completely TMI for these poor rabbits. But when they go from summer to winter, their testes actually shrink incredibly.
Wow!
And then when they go back to spring, because they're getting more light in their eyes, they actually increase.
Yeah.
So, anyways, I would imagine that there's probably some connection between light and tanning and libido. But yeah, the peptide of PT141 is incredibly powerful. The name brand of that has the same compound as something called Vyleesi, and it's actually FDA approved for postmenopausal women that have hypoactive sexual disorder, I think is what it's called.
So it's FDA approved for premenopausal hypoactive sexual disorder.
But if you're past menopause through it, sorry, ladies, no luck. No, I'm just kidding. Sorry.
Well, no, this is where the off-label
right.
of the
That's a really good
PT141
point.
is really good. So like people that are struggling with libido of any age, and really it actually works with both men and women, right?
Yeah, I mean, so there are less studies to show to prove that it works with the men, but that's so when we kind of dissect, men and women, as I'm sure you're all well aware, we look for different things in our sexual life, even though we're pairing up. And so the studies just don't correlate the men and the women. We look at one group at a time, and we saw that, hey, it works for the premenopausal women.
Okay.
And now we're starting to see, hey, this could provide a benefit in men, especially if you're looking to improve your libido or get that desire going. You're saying, hey, I love my partner and I want to be with them, and I'm looking for something a little bit more. I'm just not feeling, as energetically in the bed as in the bedroom as I would like to.
Sure.
Right? And this might be a very, good option for those patients.
Yeah, absolutely.
What's the other one?
Oxytocin.
I mean, I know that, but that's a peptide?
Yeah, it's a peptide. Yeah,
I would not have thought that oxytocin was a peptide. For some reason, it's a hormone in my brain. Am I being stupid?
Yeah, and so this is kind of where we talk about like that umbrella term of like, peptides can, in long enough chains and wrapping around each other, can become proteins.
Okay.
And proteins are hormones. So oxytocin is a relatively small peptide. It's 6 amino acids in length. Known as the love hormone, which might be a little bit of a misnomer because of how much it actually does in our body.
Okay.
I mean, milk let down, uterine contractions during pregnancy. But what we also find out is that it's a very significant hormone in bonding. So not just, with your partner or with your spouse, but also, mother, child, or father and child.
Sure.
It's just another indicator that these peptides, these hormones, just do a ton of different things within our metabolism and within our bodies. One of those things that we're starting to kind of look at with quality of life is, it can potentially improve the bonding that we have with our partner as well, which can be directly related to our libido or our sexual health.
Yeah, that's...
go ahead.
No, you go. Yeah. I'm just thinking about for people that are listening, whether it's weight loss or whether it's issues with libido or feeling connected to their partner, I just think it's incredible to have more options. Because me personally, I've always been somebody that's been kind of avoidant of medications, right? And this, like, peptides don't feel the same to me as medications when we're talking about how they operate in the body and what they're doing. Does that make sense? And so to think about if you're, especially as a woman who, I'm 38, I'm technically in that phase, of age where I could start doing premenopause, perimenopausal, that kind of thing, right? And so for me to think, like, if I reach a point where I start to feel a dip in my libido or not connected to my partner, to know that there's options out there to help increase that connection. Because, I mean, like, connection is one of the pillars of life, and vitality is the connection you have with the people around you, and especially your partner, if you have a partner. And just like with being, obese and feeling like you've tried everything and cannot lose weight, it brings hope. That you can live the life that you want to live. Not to get all sentimental, but that's like what I'm thinking about as you're 100%. Talking about what the effect that these peptides can have in your overall health and well-being.
And I think you touched on it, maybe even without realizing you're touching on it. But these medications might not be the choice for everybody, but it can certainly be tailored towards the individual. And the other thing is, that you kind of touch on is, trying other things, making sure that you are living a very well-balanced lifestyle, with diet, exercise, and just making sure that you are doing everything you can for your health. There are going to be patients at the end of that are saying, I'm doing everything and it's still not working. And this could be an option for them at this point.
Yeah. I think you make a really good point too, because I'll share, 2-3 years ago, I was going through some health issues. I put on like 20 pounds without changing anything in my diet. I had really low energy, lots of brain fog. And then I started breaking out in eczema, and it was just crazy. So I went in to get a bunch of testing done, blah, blah, blah. Found out I had some food sensitivities going on and a really bad imbalance in gut bacteria. But at the same time, I was feeling this emotional drain because none of my clothes were fitting. And I put on this weight and I didn't know why. And so I made a decision to try Semaglutide for a period of time because I knew if I could just see some forward progress, like it was going to take some time to heal my gut and to get things back in balance. And that in the meantime, for however long that healing took, at least 6 months of this protocol I was going to do, that I wanted to feel like more like myself, you know? because if anybody's ever, put on 20 pounds or more in a short period of time, it's a big difference. It just did not feel good, right? So I made the decision to try semaglutide. It was kind of like at the peak for me of like seeing it all over the place. But one thing that I wish that I'd done differently was ask more questions. And the provider that set me up with semaglutide, lovely person, really enjoyed working with her for all of the other care that I did. I just didn't feel like I had a lot of information regarding dosing, regarding side effects, and also tapering off of it and like lifestyle, right? And so I didn't know that could be like a taper off protocol, and that, depending on how you do it will determine whether or not you gain half or all of the weight back and whatever. So talking about lifestyle choice, if you're, getting on these peptides and not asking the right questions and not working with a provider who can advise you appropriately, I would just encourage people to do that, because I wouldn't say I had a terrible experience, but I know I could have had a better one. And on top of it, I really wanted to take another peptide that we haven't even talked about yet. Yeah. I had confusion on what I was actually taking and what it does in the body. It wasn't really explained to me. I really wanted Semaglutide. And so, can we talk about that? I mean, just like a little weird segue there, but like we've still got a couple more on the list that we want to talk about for just like overall wellness.
Yeah.
Yeah.
Yeah. So Semaglutide, just since you brought it up and touched on it, it's one of the peptides that can increase growth hormone, and it acts on our brains, and it can increase our growth hormone throughout our body. And again, just like a lot of our hormones, growth hormone does a ton of different things. FDA approved to use in children with short stature.
No kidding.
Yeah, I mean, you can assume what you do. You have a short kid, they've got some sort of deficiency. You give them growth hormone, and they can bump up in height.
Now, and to be clear, because like I remember like when I was like a teen, like HGH was like the big thing, and all the baby at the gym, and it was like really bad. But that's not what Semaglutide is, right? Semaglutide is not the human growth hormone.
No, it's actually like kind of like an analog. It works in the hypothalamus, and it stimulates the pituitary, which is going to release growth hormone. And so it's kind of like an inducer of it. Its aim is to increase the endogenous, or like the natural growth hormone.
Right. So rather than injecting HGH directly into your body to the point where your pituitary gland is like, oh, we don't need to do this anymore. And then it just dies off, right? Which is why HGH was like banned. Don't do that anymore. Comparatively, this sends the message to the body to produce and release the human growth hormone, which can be like, I mean, we talk about for kids, right, for the use, but let's talk about, doesn't the natural production of the growth hormone decrease as you age naturally?
Yeah, so those levels decline gradually, and because it does so much in terms of recovering, healing, angiogenesis, which is just a long term, that means, like arterial growth and blood supply growth. It can help us recover after workouts. It can help muscle regrow. It can help a lot of broken down tissue get that blood supply, get that oxygen and the other nutrients it needs for vitality and for longevity and just for endurance.
Yeah, and the growth hormone can also help with increasing bone density as well, right?
Yeah. So there are a lot of studies that suggest that works as well. And with the other thing that it does is the growth hormone can stimulate the liver and make IGF-1, which, as we know, helps moderate like our insulin levels and our metabolism, our sugar in our metabolism. Yeah. So it can help with obesity, and it can help with diabetes.
I'm just thinking about, there's as you age, there's so many things that can go wrong, but like a lot of them are, osteoporosis. And sarcopenia, which is basically just like both of those is your muscles and your bones are getting smaller and more frail. And like to be able to preserve your bones and your muscle would be such a godsend for so many older men and women that don't want to fall down, that want to continue to remain active for their children and their grandchildren. And I feel like, there's an opportunity with these types of peptides that people that are getting older and older can actually get in like the best shape of their lives, potentially, of like being able to really, bring this in. And obviously this has to be, this is not a miracle drug. No. You have to put in the work.
But you're just going to sit on the couch eating potato chips, growing big biceps.
That's right. But, I think it's such a powerful tool, and it's such an exciting time to be, in this field, and really being able to explore all these things.
Didn't we have a conversation with a guest not that long ago? I feel like it was Semorlin being used in physical therapy for being injected and like working in the joint or the muscle.
Oh, no, that was PRP, I think.
It was PRP, and we also, I could be wrong, we're going to have to go back.
I think it was Drew Timmermans.
It was Drew Timmermans,
Yeah.
and we did talk about PRP, but we brought up Semorlin in that episode, talking about the peptides and like the possibility of those things, of Semorlin actually playing a role in healing this injury.
Yeah.
And so some studies about doing direct injection and indirect injection.
That may have been BPC 157. Which is another
Star Wars robot.
Yeah, another Star Wars robot. And actually, that one's pretty interesting. And maybe we can talk about that. We don't currently carry it here at Invigor Medical just because there's and we talked about this a little bit in the episode with Drew Timmermans.
Yeah.
But essentially, FDA's kind of kiboshed it to a certain degree. There's not a ton of research around it. And so they're kind of like, we're not sure what to do about this.
Right.
Yeah. But yeah, I mean, there's lots of other things. And so, we have Semorlin, which is great for increasing growth hormone. There's also glutathione, which is kind of an interesting one because it of all of its components that it's made out of. And maybe you can talk a little bit about glutathione.
Yeah, so glutathione, it's known as the master antioxidant. So when we put our bodies under stress, when we exercise, when we break down muscle tissue, when we deplete ourselves of oxygen, we get these things in our bodies called free radicals, which are essentially just molecules that have an odd number, essentially, of electrons, right? It's having a single electron, but our body doesn't like that. We like to have them paired up. So we like even numbers, 2s, 4s. Yeah, we're really getting into
deeply
OCD.
OCD.
Sounds like society with rejection of singles. When are you going to get married? You need to get married.
Yeah, that's right.
So, I mean, we're really getting into a quantum physics lecture at this point. But essentially what glutathione will do is it sequesters, or it finds these molecules that have this extra electron, and it binds it up.
Yeah.
So that it can decrease inflammation, it can provide longevity, it can provide vitality, it can help impair our immune system, it can help with DNA repair, just a lot of different mechanisms in terms of making sure that essentially your body is optimized.
Yeah.
And so the thought is that by supplementing with glutathione, especially as we age, you could potentially be increasing that vitality, or at least keeping it stable.
Yeah, that's absolutely fantastic. And it also has effects on the skin as well. Is that right?
Yeah, they say, it improves, or patients will say they think that it improves their complexion. It takes away dark spots, essentially things that we might see worsen as you progress throughout life. Either, again, it stops them from that progression, or some will even say that they think they're looking better.
Yeah, that's fantastic. When you talk about free radicals earlier, we do trainings here at Invigor Medical with our staff, and pretty much all the staff know that when I say free radicals, it's kind of like they're like rebel rousers that are coming through. They're like, yeah, free radicals, man, give me that. And, they're just stealing electrons everywhere, and then
I love the visual. Yeah. I will forever remember what Dr. just said because of your visual.
That's right. And then glutathione is just like this massive molecule that just has tons of extra electrons. It's like Mr. Moneybags. It's just like, here, man, take this. And it's like, free radical is not so radical anymore, because it's like, okay, I'll go feed my family or whatever it's going to do. It's a little electron family. But yeah, I think it's absolutely fantastic. So we've really covered the whole gambit.
We've covered a lot of stuff.
And we've kind of jumped the gun a little bit on talking about research chemicals. We were going to kind of talk about it at the tail end there, but I don't know, maybe we can just hit on one more time. Why is it so important to work with a practitioner to get these peptides if you're going to seek them?
I think the biggest thing that you really need to take away is, whether you're taking FDA-approved medication, whether you're using it for off-label use, or whether you're getting something that, has, moderate, minimal, or no research on it, is that there is risk and there's benefit for everything. And so when you see those FDA-approved medications, or you see these, very well understood medications, it's very easy for the benefit to outweigh the risk. And so what we really need to look at is we just need to see, what is the risk or the benefit for these medications? How can it apply to my life? And, is there a chance that it could improve the quality?
Yeah, absolutely. And as you were saying that, something I was thinking about is that oftentimes there's actually contraindications sometimes with these peptides, right? And so if you're just getting this from a research chemical website, they're just going to sell it to you non-discriminately, and they have no idea. They're telling you don't inject this into your body, but they also have no idea if you have any contraindications, if you're taking a medication that's going to interact with this one, or if you're doing anything along those lines. So taking a medical intake form, getting that information in front of a practitioner that can review it, can review your symptoms, can say, yes, the benefit is going to outweigh the risks, just so that way you're completely safe. Well, I mean, I guess as safe as you can be with any of these, and that, you're essentially getting taken care of in the proper way.
Yeah, and you look at some of these companies that provide these medications, and if you really dive down deep into it and you're looking at their model of business, that's exactly what it is. It's a business model. Yeah. They might have, their prescribing physician on staff give you the script for the medication, but those physicians are kind of directed to follow their business model for getting the patients these medications that they're requesting. The thing that's really special, I think, about Invigor in particular is that here I am on board. I'm not prescribing the medications for you. Yeah. I'm not giving any of your patients the medications. I'm here to provide unbiased education. And I think that speaks a lot to a company when you're willing to have a physician on staff that's like, hey, you don't have to endorse the products. Just tell us what you know about the products or what we can find in the scientific community, and then let the patients help make their own decisions along with the provider, whether that's beneficial for them. And I think that speaks a lot to, when you are looking for someone to trust, when you're putting a product in your body or a medication in your body, someone that you can look to at least say, hey, we're doing our due diligence to treat everyone appropriately.
Yeah, and even the website has so much material and information and resources, because ultimately at Invigor Medical, the goal is for people to make informed and educated decisions for the best of their health, and to help encourage people to be their own advocate and to find alternative treatments if they need them, and need help and support in that journey, in that search.
Well, and that's a big part of the reason why we do the podcast too,
right.
So that way we can get these questions answered. And, a lot of times this is kind of our first episode that we've really done a deep dive on all of the peptides we carry, but obviously lifestyle is probably, I would say lifestyle is probably way more important than anything that you take, right? That ultimately is going to be how you're going to live the rest of your life is going to be determined by what you do on a day-to-day basis. And so,
and as you've alluded to, no drug is a miracle drug, right? So you need to have a well-rounded diet. You need to have exercise, right? Any growth hormone effect's not going to work if you're not actually breaking the muscle down to build it back up. The Terzepatide and the Semaglutide, it's not going to work if you're just putting garbage into your body for the little nutrients that you are getting. And so all of it's in conjunction with a well-balanced lifestyle.
Absolutely.
And it can get you going in the right direction sometimes. You just need that little boost forward, right?
Yep,
just so I mean, honestly, that's what it was for me. It was like, oh yeah, I'm not stuck here forever. Things can move in the direction you want them to go. And I think, like I said earlier, just being for people to have hope for improvement, really, that is a gift in and of itself.
100%.
Yeah.
Well, this has been an absolutely fantastic conversation. Is there anything else that you would like to leave our listeners with?
Honestly, just kind of we've already touched on is just be well informed. Do your own due diligence. If you tell your provider, hey, I want to do some research on this, don't just read the first 2 Google links. Talk to well-informed individuals, find reputable sources, and make sure that you are making healthy decisions for yourself.
100%.
Love it. We're so excited to have you on board, Dr.
I'm so happy to be here. This has been a lot of fun.
Good.
And we're excited too. And he's going to continue to be a repeat guest. We're going to bring him back on, and we'll be able to do deep dives. So if you have any questions specifically that you want to ask Dr. Hamilton, please leave them down in the comments. Also, if you're interested in starting any of our treatments that we carry, you can get 10% off your first order with Podcast 10. Podcast 10. And we're more than happy to get you started.
Dr. Hamlin, it's been so much fun having you on today. I'm excited that we get to have you back. Derek, I missed you this summer.
Man, it's great to see you,
Natalie. Oh my gosh.
It's so good. I'm so excited to have you back in the studio.
So fun to be back in the studio.
We're going to be back up to our hijinks again.
I know. I was just so giddy this morning telling my boyfriend, I'm like, I get to go be back in the studio today. Super fun. And thanks for being here for the first one. in our new studio. And
it's
remember,
been great.
Yeah, if you're listening, be sure to just pop on for just a second on YouTube to get a look at the studio. The team here at Invigor Medical has done a really incredible job.